let's bring in Dr. Eduardo Celades, who is the Chief of Public Health at UNICEF. Thank you so much. Good to see you on Newsnight again. The last time you were here, we were talking about vaccines, and now malaria vaccine. This is a major breakthrough, a major milestone. How significant is this, and why are you starting with children first?
So indeed, well, thank you very much for inviting me here tonight. And indeed, this is great news. We need to share that with everyone. So finally, we have malaria vaccine in Nigeria, right? So this is fantastic news. However, it's important to say as well, malaria vaccine is only one of the tools that we have, right? It's not a magic palette. It will be very useful. It will save lives. It's extremely effective, right? Reduces more than 75% the probability of getting malaria, right? So it works. It's safe. It's effective. It's a great tool. It's not the only one. Right? We still have mosquito nets. We have seasonal chemoprophylaxis. There are other tools that they are, right? So we need to work. It's not because we have malaria, we need to forget about.
You're not discarding those.
Correct,
okay,
right?
Great.
So the great news are there. However, as well, we are getting basically 1 million doses of vaccines. Yesterday we received 846,200, and we are receiving 150,000 more in the next few weeks, in a couple of weeks. That's not enough for malaria, right? For these vaccines to work, you need 4 doses. Right. And this is for children. So we'll start with children of 5 months, first dose. Then the second one is with 6 months, 7 months, this is 3 doses. And then like a sort of booster with 15 months. So basically, to be fully protected, you need 4 doses. And we're going to have only 1 million doses to start. You can see that it's like still many, many children in Nigeria, they will not have access yet to this. So it's a powerful tool. It's great news, but there's still a lot of work needs to be done.
Because at least, it's great news. It looks like a drop in the ocean going by the numbers. 27% is what Nigeria, yes. All over the world, we have 27% of malaria cases. Help us understand why this is, and in comparison to other regions, what factors are responsible for giving this very ugly number to Nigeria, 27%.
Right, not only that, it's 27% of cases, but if you look to deaths, it's 1 out of 3. 1 out of 3 deaths of malaria in the world are in Nigeria. This means, I think you mentioned that, 194,000 per year, more than 500 every day, most of them in children and some pregnant women, right? There are different factors. One, obviously, is the geographic factors, where we are in the world, right? So we, in the malaria world, we always talk about shrinking the map. We're trying we're fighting malaria and removing countries, eliminating malaria in some countries, but the last ones are going to be the ones in this latitude, right? Because it's for the climate, it's more complicated. But as well for other reasons, right? As well for the environment, and as well for the lack of protection, and of course for the numbers, right? So the mosquito of malaria, the Anopheles, they like children, they like babies, right? So in this country, we have 8 million babies, new babies every year. Yeah. When you look at that from a global perspective, the problem in Nigeria is massive. One challenge that we are facing is that the capacity to produce malaria vaccines is still growing. We don't have so many in the world. That's why we are receiving only at this moment 1 million doses of vaccines. So it will take a little bit until we get the vaccines that we need for everyone.
So how do you overcome the challenges, one, of accessibility, especially in the rural areas where you have a huge prevalence of malaria? Nigeria has about 33,000 primary healthcare centers, as I hear, but less than 20% is actually functional. How are you looking at addressing that to ensure that, you know, these vulnerable populations are not left behind?
So 2 things. As you said in the news, the malaria vaccine is going to be rolled out in 2 states to start, in Kebbi and in Bayelsa. In Kebbi, because it's the state with highest prevalence of malaria. So it's the state with more malaria, right? So it's logic to start there.
To start there.
So we're going to learn from that. Because this is not easy, this vaccine. You need to start with children with 5 months. That is not a normal month that you go to the health facility with the baby, right? Then 6 months, 7 months. So we're going to find challenges. And as you said, one is going to be access and the health facilities. The good news, as you know, the Federal Ministry of Health has implemented the swap and aims to have 17,000 health facilities fully functional 24/7 in Nigeria over the next few years. So we're seeing how this is progressing. This morning we had a meeting on that, and we are seeing how every day, every month, we have more facilities that they are able to provide the services. So we really hope this works, and we really hope that the children of Kebbi and Bayelsa to start, and eventually all the children in Nigeria, they have access to the vaccine, free of cost.
Yeah, free of cost. And that's a good story there. But again, what systems are in place for you to actually measure its deployment?
Right. A very good success of
the success. Right. Right. So we have developed jointly with the Federal Ministry of Health, NPHCDA, and partners. We have developed a plan to deploy the vaccines. Right. So in the next few weeks, the vaccines are going to be deployed, and we're going to monitor that to the 2 states, and then to the LGAs, and then to the facilities. And then we're going to have like a semi-campaign type to be able to reach the children that we want to reach. So we are confident that the vaccines are going to arrive to the children that they need it. Right. And as I said, the vaccines are not free. What they are free of cost for the children that they're going to receive them.
Great.
Right?
Super. Now, you know, in this part of the world, we say you do not cut a person's hair behind their back. Do you understand that? I mean, it's in a simple form. Like, I mean, you have to be here for me to cut your hair. What am I driving at? I mean, Nigeria, Africa, at the receiving end of malaria and its impact. And I'm wondering, you know, to what extent really was Africa or Nigeria involved in the research to come up with this vaccine in a way that they have confidence that, yes, this has efficacy and it is good for human, you know, consumption, if you like.
Yes, indeed.
Yeah.
Look, very good question. So in the world, at this moment, we have only 2 malaria vaccines that they have been pre-qualified. And this is quite new. It came like from end like 2023 and early this year. The R21, the one that arrived to Nigeria, and the RTTSS. Nigeria, NAFDAC, was one of the few the first countries that actually pre-qualified even before WHO, after the studies that they were conducted here. Right? So the vaccine was tested in Ghana and in some neighboring countries, but then in the lab, NAFDAC was testing the vaccine. Why? Because they wanted to be ready. They wanted Nigeria to be able to access this quickly. It's a lot in stake, right? A lot of people can die, a lot of children. Yeah. So I think the government was very proactive. And let me just tell you something that you asked me about my Nigerian knowledge. So I arrived to the country 3 years ago. When I arrived to Nigeria, we didn't have HPV vaccine. Remember that
human
was
papilloma virus.
Yes, human papilloma virus was introduced last year. We didn't have malaria, of course not. We didn't have the meningitis, the conjugated meningitis. We didn't have rotavirus. So the progress that this country is doing to try to reduce child mortality using one very powerful tool is not the only one. Right? Yeah. That's very important to say.
It has to be stressed, yeah.
But I can see that progress in yearly basis.
Well, I look forward to us talking more about vaccines and pretty much talk about your knowledge about Nigeria in the last 3 years. Eduardo, thank you very much for your time as always.